Good afternoon. Today we'll be answering a question from Mercedes. She's from Guadalajara, Mexico. What is the post-operative care? This is a very standard and common question. So surgery is performed as an outpatient procedure, so the patients go home the same day. Following that, their first appointment is usually on the second or third day after surgery. During that appointment, we see the child, make sure that he's doing okay, he's recovering well, and we remove the head absorptive dressing. We do not remove the ear mold. After the ear reconstruction, we suture a silicone ear mold to the newly reconstructed ear, and then rewrap the head with the dressing. That dressing is the one that goes away on the second or third day after surgery. We keep the mold for a total of 2 weeks after surgery. At the 2-week mark after surgery, we remove then the mold, look at the ear, wash the head of the patient in the office, and then make sure that everything looks okay. At that time also, we make new mold that the patient has to wear at night over the next 4 months. This new mold allows to control the swelling of the new ear, but also helps maintaining the sulcus behind the ear, because over time, if you don't use that mold, the ear may go back close to the skull, and that's why we highlight the importance of wearing this blue mold at night over the next 4 months. If we see that the ear is very swollen, we may also use a little steroid cream under that mold at night for 1 or 2 weeks. So this is the usual post-operative care that we do. The most important thing is after surgery, it is important that the patient does not sleep on the newly reconstructed ear. So if we do surgery on the very young kids, we ask the parents to sleep with them over the first few weeks to make sure that they only sleep on the non-reconstructed side. Mercedes had another question. What is the recovery period? In our experience, and we perform most of the ear reconstruction in this country, patients are usually back to normal within 2 days after surgery. As long as the patient keeps the head dry, does not wet the mold or the dressing, they recover extremely well. They bounce back very well. We have a lot of patients from all over the US and over the world that come and visit us, and the parents take their kids to the zoo, to the beach. The only thing we ask is for that ear and head to not be wet in the first 2 weeks after surgery. But kids bounce back extremely well. Her last question is, where is the surgery performed and who will be the anesthesiologist? Since the surgery is performed as an outpatient procedure, we perform most of the surgery in an accredited surgery center. This allows us to start the surgery early. It is a very comfortable center for parents to stay, and they're very used to outpatient procedures. The surgery centers that we work with are very used to Medpor ear reconstructions. If a patient has genetic syndrome or significant comorbidities like heart problems or lung problems, then we will perform the surgery at the main hospital. In terms of who will be the anesthesiologist, we work with the same anesthesiologists. Those are certified pediatric anesthesiologists that are trained with us doing ear reconstructions. They're part of the same group, they're part of the Cedars-Sinai anesthesia group, and they're very used to treating kids with Microtia.